I'm Femi and I'm here with...
Kathy, Maxime.
And what do you do?
So I'm a nurse. And I'm a nurse as well.
And you're a nurse. And how has it been working in the NHS for the last 10 or so years?
So things have been very different working as a nurse in the NHS over the last 10 years. So I've been in the profession for 33 years. So I started my nursing in 1989, and actually the last 10 years there have been significant changes to how us as a profession have had to work and the standards that we've had to work with.
Absolutely. And what has that meant for patient care?
So our patients, there aren't enough staff, there aren't enough nurses to care for our patients safely. So every patient is being put at risk because of the numbers of us nurses.
Yeah.
And what's driving nurses away? Why aren't there enough staff?
Well, I think it's the pressures of the job, and we know at the end of the day that we're having to go home knowing that we haven't been able to provide everything that we want to provide because of the lack of staff that we've got. And I think people can only work so long under those pressures. We've had the pressures of the pandemic as well. So all of this has just meant there's incredible pressures, and I think that's why people are leaving.
And I imagine you got into this job because you care, and so knowing that you're not able to provide the level of service that you want for the people that come to you, how does that make you feel?
It's really very upsetting.
Yeah.
We're nurses because we care passionately about
Absolutely.
looking after patients and providing the best possible care.
We don't want to strike.
No.
And so what happens if you don't go on strike?
Things will continue as they are now, so patients will be put at risk every single day. So every shift, there are 83% of shifts covered by nurses that are understaffed.
Yeah.
So that is providing unsafe care for our patients. That is putting patients at risk. So we are nurses because we deeply care about our patients, and we're not being allowed to do that.
And we care about each other, we care about the future of nursing. We can't see that people are attracted to the job because they hear about the pressures, and that's not what we want. All of us want to know that if we were a patient, that we would go to hospital and we would have good patient care, and it's really scary thinking that, that's not happening.
It's not happening. There are 50,000 nurse vacancies in the UK. So if you imagine one nurse makes so much of a difference to a patient. 50,000. Do you imagine what 50,000 nurses? We're not keeping nurses in the profession. They're leaving, they're stressed, they're upset, they're demoralised, we're undervalued. We're not keeping our staff, we're not retaining our staff, and we're not recruiting staff.
And we're just asking for fair pay for the job that we do, for the responsibility that we take. And we know that then if we have more nurses in the profession, then we can improve patient care.
So you basically want to turn the NHS into a place that people want to come and work, so you can provide
Absolutely.
And that was what the NHS was always like that. It was the most wonderfulest place to work 30 years ago. We all wanted to work in the NHS.
We're proud of the NHS.
Exactly.
We want it
Very
to carry on.
privileged to work as a nurse and care for people. And things have got to change. And enough is enough. And I think we've put up with this.
Enough is enough.
We've put up with this for the last 10 years, and I feel quite appalled by our support from the government.
Yeah.
I think not even sitting in a room and negotiating
Won't
with
even
our
negotiate.
RCN lead Pat Cullen is appalling.
Thank you.
And at the end of the day, we've all got family and loved ones who are going to be patients.
Yes.
You could be a patient, I could be a patient. And we want our patients and families and loved ones to be cared for and to be cared for safely.
And
this government needs to listen to that.
And what could improve in terms of patient working conditions?
So if you treat the nurses as we would like to be treated, so if we're getting fair pay and improving our working standards, most of us don't have breaks. So lots of nurses work 12 hours. They don't have a break. They're often leaving late. So if you add up all the hours that a nurse works that you don't get paid for in a week, those are really important things. We're getting burnt out, we're getting stressed, and we're getting burnt out. If those things are improved, ultimately our patients will receive a better, safer care. And that's what this is about.
It's really difficult to finish on time, because when you haven't got enough staff, we just have to keep going so things are done. And unfortunately, that means us often missing our breaks, often working over at the end of the day, and that's overtime that doesn't get paid. And we do that because we're trying to support one another on the team.
And not finishing on time, that must be havoc for childcare if you've got kids.
Absolutely, family life.
It's everything. It is absolutely everything. It affects everything outside of work. Today we've just had so many members of the public bringing us drinks, bringing us pizzas, bringing us cakes, which is absolutely amazing.
We were nervous this morning to come and strike, and the public have really made us feel proud again, and made us feel that this is so worthwhile. Enough is enough, and we just want the government to listen. The public are listening, and we want the government to listen.
We're very, very proud of my profession.
Absolutely.
Very immensely proud of the nursing profession.
Thank you, and thank you for coming to talk to us today.
Pleasure.
Thank you.